put on the spot by the Senate Health Committee over how it has utilized previous budget allocations. This comes as the ministry is set to receive an additional 85 billion, that is shillings, in the 2025-2026 budget policy statement. Some senators argue that the ministry does not deserve more funds due to lack of transparency and accountability in its spending. However, MOH officials maintain that they need additional resources to bridge a significant financial gap, as Elizabeth Atieno details.
Tuesday, the Ministry of Health officials led by CS Dr. Deborah Barasa and the two principal secretaries Harry Kimtai and Mary Mudhoni appeared inarticulate as they were unable to explain how they have utilized billions of funds allocated to the ministry. A section of senators from the Senate Health Committee maintaining that the ministry does not deserve an increase in budgetary allocation unless they give a detailed breakdown of how the resources are being utilized.
There's a lot of unnecessary spending in the Ministry of Health, government spending. And I think it's about time for us to cut that spending.
You should provide a very comprehensive, detailed, itemized breakdown of that recurrent expenditure.
The State Department of Medical Services says it is grappling with a funding gap of 254.2 billion Kenya shillings following the allocation of 172.6 billion Kenya shillings against the 426.8 billion Kenya shillings needed to spearhead the operation of 4 key programs, including 56 billion for the National Referral and Specialized Services, 17 billion for the Curative, Maternal and Child Health, 3.6 billion Kenya shillings for the Health Research and Development, as well as 95 billion Kenya shillings for the General Administration, Planning and Support Services. Records from the Ministry of Health Finance Department reveal that the budget for the entire health sector has grown from 118 billion Kenya shillings to 204 billion. The budget for the State Department for Medical Services has increased from 91 billion to 172 billion Kenya shillings. This increase has been attributed to 76 billion Kenya shillings allocated to the Social Health Authority.
The budget of SHA, which is the collections that they are going to collect of 76 billion, was not included in our budget.
However, questions arose as to why SHA is domiciled under the State Department of Medical Services, yet it was designed to be semi-autonomous. PS Kimtai explaining that SHA could not be independent since the Primary Healthcare Fund and the Emergency Chronic and Critical Illness Fund are funded by the Exchequer.
Now, as an authority, they will be handling those functions as a state agency.
The money is budgeted for under the Ministry of Health and then pushed to us for us to be able now to apply it under the fund.
So far, 20.5 million Kenyans have registered with SHA, with only 5 million contributing to SHIF. SHA now revealing that not all Kenyans are mandated to channel their monthly contributions to the fund. Elizabeth Atieno, TV47, Nairobi.